course, our superintendent, who will be welcoming us in a second, Mr. Anthony DiCarlo, the superintendent of schools. We have Dr. Greg Stoll, our assistant superintendent for pupil personnel services and educational services. We're also joined by Deborah Legato. So again, we wanted to share with you the team that was that helped not only facilitate this plan, but that also has helped join the call today. Our purpose of today is to provide our community with an overview of our current approach to reopening in the fall. It's continuing this conversation. Today is not the first time that we've had conversations about how we're looking to reopen, and it's not the last time we're going to have a conversation about reopening. And we'll talk about what are some other ways that we can continue on this conversation. We also wanted to be able to answer your questions from our community today because we do know that this is a very important aspect of what you're thinking about over the summer, and we wanted to provide a venue for you to be able to answer any of those questions, to ask those questions. Brief agenda, we're going to go over some etiquette in our Zoom meeting. We'll turn it over to Mr. DiCarlo to welcome our community together. Dr. Stoll will give an overview of our reopening and mitigation plan. I will jump on to talk about the teaching and learning environment. We'll open it up to community questions, and then we'll talk about our next steps. Just a few logistical items. This Zoom session is being recorded. It's also being live streamed, and it will be recorded and placed upon our YouTube channel. So we want to thank our technology staff for facilitating that. Your attendance in this session is giving consent to be recorded, both audio and or video. And we would ask that if you do not give consent to your audio or video, you can still join by either watching the live stream, or you can mute disable your camera or mute your audio. We would ask that when you're reviewing, you disable your audio and you mute your microphone, just to make sure that everybody has an enjoyable and an effective connection experience. We have disabled the chat, and we're not disabling the chat because we want to stifle any questions. But what we found in large calls from as best practices, that in a large call such as this, it's often hard to make sure that you've addressed every question that's been in the chat. So what we would ask you to, and there appears to be, well, you're answering some questions and not answering the others. We don't want that to happen at all. So during the Q&A, we will ask you to raise your hand function during the chat. And the way that you can raise your hand during the chat is if you go into the bottom of your screen, you can click on the participants button. You should be able to see the options at the bottom of that participant function. When a new screen opens up, you will have the option to raise your hand. And that's how we'll know, as hosts of the meeting, Dr. Stoll and I, will know that you have a question, and we'll try to get through as many questions as we have in the time. But we'll also talk about, if we are unable to get to your question, ways that you can submit those questions to make sure your concerns or your questions are addressed. In short, we will direct you and we'll show you our reopening website, which is a site dedicated to our reopening plan. So that's going to be definitely something you want to bookmark in your favorites of your browser and check often. There will be a spot where you can submit a location for that. So we'll definitely take some time to go through there. Just as a reminder, please view the information that we're presenting during a public health crisis, during any crisis, is fluid, particularly this crisis, because we are waiting on information from a number of different regulatory or authoritative positions, such as, but not to fully encompass who's providing information to us. But we rely on information from the governor's office, from the New York State Department of Education, from Department of Health, from best practices, from changes in the health crisis itself. So we are presenting you with information to the best of our knowledge at this time. But please view this information as fluid, because in any crisis, there are changes that may need to be made. So please definitely keep in mind, we hope that we have open lines of communication, and we will present you the best knowledge that we have at the time. Just want to make you aware of two important contacts. The district has appointed two individuals, Dr. Greg Stoll and myself, to serve two important roles as we look towards the fall and beyond. Dr. Stoll has been appointed as the district COVID-19 safety officer. Dr. Stoll's role in that aspect of his job is to ensure compliance with the reopening plan that we've submitted and going forward. I am the district's COVID-19 resource officer, and I would be the point person for you to have any questions or direct any questions about the COVID-19 health emergency itself and the district plan and implementation. So if you have a question that you do not submit, we would urge you to submit through the website that we're going to share with you a little bit later. But if you address a question to Dr. Stoll and I, we'll make sure that we put our best thinking together and we point you in the right direction if we can't answer that question right away. So those are two, and this can also be found in our plan that was made public on Friday. At this time, I'm going to stop sharing my screen, and I'm going to turn over the video controls to Mr. Anthony DiCarlo, who is our Superintendent of Schools.
Thank you, Mr. Tremblay, and also to Dr. Stowell, to Assistant Superintendent Clohesi and Assistant Superintendent Legato, and to the families that are out there. I hope you are enjoying somewhat of your summer. I know during these troubling times, it's not easy for anybody. It's very hard to travel anywhere because of what's happening with COVID around the country, but I hope you're getting some rest and being able to share some enjoyable time with your families. As you are aware, and this goes back to beginning of March, the Mahopac Central School District, myself, the cabinet, and the leadership team has tried to be constantly updating you on Tuesdays and Fridays, as you know, about things that are happening. And now, of course, we're to the point where we're in a new school year. And just want to thank you for your patience and your cooperation and understanding. These are not easy times. As Mr. Tremblay mentioned, a lot of what we can and can't do is being governed by guidance. That's from the state, that's from the Department of Health, it's from the Education Department, as well as the governor. So the plan that we sent out on Friday really is a snapshot of where we are right now, meaning today, August 3rd. A lot can change between now and the beginning of the school year. And as those things develop and change, we will be updating you along the way. Although the governor has asked for 3 proposals, meaning full-time for everybody, hybrid, which is half in and half out, in person and virtual, and then of course, which is all remote. I mean, as it stands right now, on the bodice of what you're going to be hearing today, and when both Dr. Stowell and Mr. Tremblay talk a little bit about safety and instruction, we're really looking at right now the hybrid model, which is in person and virtual. However, and I want to make this very clear, we are not stating that this is something that if you're uncomfortable with as a family because your son or daughter, yourself, or some family member may have some type of a compromise, you do have that option to go virtual the entire time. But we just ask that you let us know, and we'll talk about that opt-out. So we as a district are trying to be as accommodating as possible, but clearly understanding we want our kids to come back to school to at least have somewhat of normalcy opposed to what happened last year, especially in the late winter and early spring. With that being said, we learned a lot. And what you will hear from Mr. Tremblay is a little bit about what that new remote instruction will look like, what the hybrid in-person will look like, and how we're collectively working together with not only our teachers' unions, but with all our unions. What's really important is that we've begun. Last week, we walked 3 schools, and we spent at least 3 to 4 hours going through every aspect of the school, from the beginning of the day to the end of the day, what drop-offs will look like, what pickups will look like, cafeterias, libraries, classrooms. So we're really doing an effort to make sure that we are all seeing and hearing and working together. So when schools do open, hopefully in September, everybody has a clear understanding of what those health and safety parameters are and what those instructional parameters are. As I mentioned, we're hoping that this week the governor will let us know whether we can have some of that in-person learning or whether or not we will be fully remote. I can't answer that. He will. And then once we have a better understanding on that, we'll be able to say, okay, here's what we're looking to do come September. But I need to be honest with you. As you know, when you're hearing this across the country, things are changing from day to day and week to week. Just because we may start in a hybrid model doesn't mean at some point in time we're going to have to go to remote, fully remote. And what we're trying to do in this plan, moms and dads and students who are listening, is try to, if we have to do that, to try to have as much continuity of instruction, regardless whether we're in a hybrid, fully remote, or come back out of remote and then go to hybrid. So I think you'll see that in the plans and what we're doing. We're here to work with you, to work together. We don't know all the answers, and we probably won't as the year goes on, but we want to work collectively for the betterment of all. And I mentioned this in my spotlight, and if you haven't seen the spotlight, I really encourage you to do that. We cannot make this happen, moms and dads, if we don't explain to our students, K-12, the importance of following those guidelines. It's really, really important that they understand about social distancing, understand about wearing masks, understand about how to sneeze and cough. Because if we do all those right things, I'm cautiously optimistic that we'll be able to stay in school. If we don't, and we don't follow those mandates of wearing masks on a bus, and we decide not to take these things seriously, we're going to be back on full-time remote. Nobody wants to see that happen. So I thank you once again. I look forward to our meeting today, and any questions or concerns that you may have along the way. We are hoping that in today's town hall, we can answer some of those questions. I'm going to turn it back over to Mr. Tremblay. Mike?
Thank you, Mr. DiCarlo. So as mentioned in our agenda, we are now going to ask Dr. Greg Stoll, our Assistant Superintendent for Pupil Personnel Services and Educational Services, to give us a high-level overview of our reopening and mitigation plan. I will be sharing my screen at this time so that you can see the presentation as we go through here.
So thank you, Mr. Tremblay. Also, thank you, Superintendent DiCarlo, and I hope everybody out there is doing well. I certainly can understand that we have almost 200 people on this call. It's really great to have our community have an opportunity to listen about our reopening plan. And I think one of the things that is most important would be that everything is built upon the safety of our staff, of our students, and of our school community. The whole plan is built that way. And so what I would like to do is, I'd like to, Mike, I will share my screen, kind of open up the plan and just go over the highlights. It's a 60 page or so plan. And obviously I can't today in our time together go over every single aspect of it, but I want to pull out the salient points and make sure that we go over those together. The first, just a little bit of housekeeping, how this plan is built. It is built taking in the considerations of some guiding principles. One, as I said at the onset of my discussion, health and safety of our staff and our students and our community is first and foremost. And in that, we have to think about our facilities, how we feed our students, how we transport our students. We have to think about their social emotional well-being. We talked a little bit about how school schedules will help us with the mitigation of COVID-19. There are definitely budget and fiscal impacts, student attendance, as well as technology and connectivity, because as Mr. DiCarlo said, we start in hybrid. There will be some students working remotely. If conditions in the community change and we're required to go all remotely, technology and connectivity is really important. Mr. Tremblay will talk at the end more about teaching and learning, and also we'll talk about special education and bilingual education. And obviously, staffing and human resources are part of it. So let me just do the Reader's Digest version. And certainly, as Mr. Tremblay said, you can contact him or I about further questions. We'll have some Q&A at the end, as well as a place on our website, our dedicated website, to drop some questions. And our hope is that we will develop an FAQ based upon all of the questions we get here today, the ones that are dropped in on our website, and we'll update that regularly. So the first and foremost, in terms of following Center for Disease Control, following New York State Department of Health, is that our staff and our students must submit to a self-screening every morning before they arrive to the bus stop, step into our schools, or arrive at work. We are working right now, and more information will come out, on developing an app that will do a COVID-19 screening consistent with CDC recommendations, that will ask questions about fevers, about symptoms, and some other COVID-related questions. If your student or you as a staff member respond positively to that, you'll be instructed to stay home and report your absences pursuant to the processes and procedures, whether you're a staff member or a student. Mr. Trombley will talk a little bit more about if you respond positively as a student but still feel well enough to attend. He'll talk a little bit later about those students, if they were supposed to be in school but responded positively to the health screening, they still can participate remotely. But you would still have to call in their absence. We do have in here procedures about returning to school after an illness. I won't go through them completely. We want to make sure that we're giving, and it's on our website, which we'll talk about a little bit more, communication to our staff, to our faculty, and to our parents and guardians and our community about what the proper protocols are to keep yourself safe from personal hygiene, respiratory hygiene, mask wearing, things of that nature, as well as understanding what the symptoms of COVID-19 may be. And we know that there are certain risk groups that are more susceptible, as Mr. DiCarlo alluded to. There are processes and procedures for those students and or those staff members to get potential accommodations for that. Again, we're going to participate with the Department of Health. And really importantly, in terms of that, is contact tracing. We don't do it, but we assist in that process, as well as they make the decisions whether or not a school needs to close because of a COVID-19 incident or increase in infection rates. We don't make those decisions on our own. We're guided by our Putnam County Department of Health. The other thing is we have a really significant and robust disinfectant and cleaning protocol that we're putting in place in the district plan. Down below by locale, it really spells out specifically what classroom cleaning looks like, what hallway cleaning, what bus cleaning looks like. But in general, the things that we're doing is every night, every building, every bus will be thoroughly disinfected with an agent that is recognized by the Center for Disease Control of being able to manage COVID-19 or have a kill factor for COVID-19. That's every night, every building, every location. In between, during the day, there will be frequent cleaning of high-touch surfaces, doorknobs, light switches, handle rails, things of that nature. And in between bus runs, those buses will be cleaned and wiped down in between. But again, health offices have their own specific procedures that are even more robust. And that's included in the plan down below. The other thing that I want to let everybody know about is that we have an ongoing communication system. We have a website. We use our social media. Mr. DiCarlo is sending out frequent communication about the reopening of schools. And again, as I said, school closures are dictated by the Department of Health. And I'm not talking about like weather related, but when there's a school closure due to the outbreak, hopefully not, but an outbreak or a suspected case of COVID-19 will be directed by the Department of Health. And again, in this plan, it really looks at how do we make sure that we reduce the spread by our footprint of our facilities. And that means, as Mr. DiCarlo and Mr. Trombley said, starting out in a hybrid, we hope will reduce the density in our hallways, will reduce the density in our classroom, and allows maximizing spaces between students, hopefully up to 6 feet. Knowing full well that classes are going to look different, and Mr. Trombley will talk later. School is going to look different than it did prior to the COVID-19 pandemic, and we know that's important. The other considerations in this plan is ensuring that all of our students, whether they're working remotely, whether they're in school, have an ability to access school food services and that those services are done in a way that have certain precautions to ensure not only do students get food, taking into account their allergies or any sort of special dietary requirements, but also that they're handled safely and distributed safely. Transportation, this is really important. I think, as we said earlier, prior to the school bus, sending your kid on the school bus, prior to them coming to the bus stop, please ensure that your child has a mask or face covering. It's really important that they have that, and that you have completed your health screening prior to the student attending the bus stop. If for whatever reason your child drops it, their face covering, forgets it, it malfunctions, there will be additional ones on the bus. Face coverings on bus are required, knowing full well that there are certain students that have medical conditions or have certain conditions that preclude them from wearing a mask. We understand that. That was obviously on a case-by-case basis. Please note that our drivers will also have additional PPE. They'll be wearing face masks and face shields and have gloves with them as well. The other thing is we're going to be loading differently. We're going to be loading, from back, or, loading the bus at bus stop from back to front, ensuring that students are crossing as little as possible. And then when they get to the school buildings, we're going to be releasing from front to back with the bus driver monitoring the disembarkment of students to ensure that there's additional distancing. Again, also with the weather and things like that, bus windows being open is really important too, unless there are certain specific students that have accommodations on a bus that preclude them from that. We also know that for all of us, including myself and our teachers and our families and our staff, this is not going to be school as usual. And we know that having an extended closure and having this summer and questions of uncertainty, that there is a social and emotional toll taken on all of us. We're going to be working really hard with our clinicians and our guidance staff and our building leadership and our teachers to really start to address this systematically as students and staff start to return. I think, as Mr. Trombley said and Mr. DeCarlo said, we don't have all the answers, but we know that this is an important component, and we have already started to reach out to some of our clinicians to say, what do we need to put in our schools so that our staff and our students can have a place to go, that they can feel safe, and if they're feeling dysregulated, they have a support structure for them. That's really critically important as well. I'm going to let Mr. Trombley talk about school schedules and attendance and absenteeism. I also want to just stop here for a minute and talk a little bit about technology and connectivity. As you know, in March, we sent out the door all of our students K through 12 with a Chromebook. For those that didn't have one, we got one to them. The other side of that coin is they also have to have connectivity at home. We do ensure that students at home and staff at home have full connectivity. If there is an issue, we will get them connected, either by working with their internet service provider, by working with their wireless cellular company, or supporting them, or in some cases, if needed, we will provide a MiFi or a hotspot in their house. We want to make sure that all of our students are connected. So the other thing is we have new students coming into the district, and we have kindergartners that are new to the district as well in terms of their first time. You will be hearing something from us in August about a pickup time for kindergarten students to get Chromebooks, start the year with Chromebooks in hand, as well as any new students. So that information will be forthcoming from our department as well. Mr. Trombley, again, we'll talk about teaching and learning, and special education we will talk about, as well as ENL. Obviously, there are staffing and human resources implication, and Ms. Elgato is on this call as well. So if there's questions about that. And the last thing I will say is, if you really want more specifics on each of those items, it is broken down later in the plan, starting on page 37 by location. So if you want to know, for instance, our cleaning protocols and how we're going to space kids and what's required, you can look down at school buses and see how we do that by the school bus. Conversely, if you want to look at how we're going to do those things in classrooms, you can scroll down a little bit further and see classrooms. So I appreciate for your time. I know that's a lot of a talking head in front of you on a screen. I appreciate your indulgence. We do look forward to the questions and answers. I'm going to turn it back over to Mr. Trombley.
Thank you, Dr. Stoll. I will go ahead and share my screen for this portion of the town hall. I will be making reference to the details that can be found in our 2020-2021 reopening teaching and learning guidelines and procedures. And that document, which is attached to our larger reopening and mitigation plan, is the repository where we will be detailing everything related to teaching and learning for both parents and teachers in terms of expectation. So that document lives in our larger reopening and mitigation plan, but it also has its own spot on the website, and you can drill down into those details. I want to focus first on the instructional schedules. So the bottom line is we miss your children. We miss our students. We miss having them in our classrooms. We know that this pandemic has taken away a fundamental vein of your child's growth and development in terms of being able to interact with their peers, interact with their teachers. So we know it's been difficult for everyone. We at this time do not have the physical plant to bring everybody back in within CDC social distancing guidelines. So due to that, as of today, we anticipate starting the year on a hybrid schedule, which combines in-person and distance learning or remote learning. And we're terming it a hybrid schedule because it limits the number of students in the building at one time, allowing us to adhere to those health standards and getting some students in front of us on a rotating basis. This hybrid schedule will emphasize our teachers interacting with our students in a socially distant and appropriate manner, both in person and remotely, in real time with strong synchronous and a live learning component. So if we drill down to that hybrid schedule, it's detailed in this in the reopening teaching and learning guidelines plans by building or grade level. So if you want to see the details, the plan begins on page 5 for the elementary hybrid learning schedule. You'll see it's similar throughout all of the grade bands, but it does have some minor differences. It can be found on page 8 for our middle school, and then on page 12 for our high school. So if you're following along with the plan at home, that's where it can be found within the plan. Just to give you the high level overviews, for the vast majority of students, they will be assigned to a cluster of students into 2 cohorts, a blue cohort and a gold cohort. And what that means is that if you look at the particular schedule for the building that your child attends, on those blue designated days, once the cohorts are assigned, and we anticipate being able to get you that information on or about the 14th of August with a few conditions, and we'll talk about that in a second. On the blue designated days, if you know your child is in the blue cohort, when it is a blue day, those students in that cohort will be on site present for learning in the building. So they'll have done the health screening if it's a blue day. If they're in the blue cohort and they need transportation, they'll get on the bus, they will attend school. Students who are assigned to the gold cohort will engage remotely with learning. So they'll connect and they'll follow their daily schedule. They will connect via a stream that their teacher will share with them to that class. So if it's a blue day, I'm a blue student, I'm in the blue cohort, I'm in the class learning from my teacher. If I'm a gold student in a gold cohort on a blue day, I will be connecting remotely. It will switch on gold days. On a gold day, the gold students will be in site learning in person, and the blue students in the blue cohort will be learning remotely. That is what the vast majority of students will be assigned to in this hybrid learning model. For high need students, and Dr. Stoll can jump in here as needed, for high need students with disabilities that receive extensive services, to the greatest extent possible, they will be in person receiving those services. Specific scheduling decisions about who those students are will be communicated directly with families. And Dr. Stoll, do you have anything you want to add to that?
Just that, we have a population of students with disabilities who require intensive special education services, supports. A lot of their instruction has to be hand over hand, really intensive, full day special class. Those students, to the greatest extent practicable, as long as there's not some sort of executive order or some sort of legislation or regulation in, our plan at this point is to have those students in daily and those families and will be communicated with by the special ed administrator. And again, for those are for our most high needs special education students that require intensive special education supports and services throughout the school day.
Thank you, Dr. Stoll. And in a similar manner, for our English language learners who are most at risk, either for academics or other factors that our English language English ENL teachers and building principals have identified, we will provide them with daily in-person opportunities for learning as well. And specific scheduling decisions about that will be communicated to families directly as the summer goes on. Now, we talk about the hybrid schedule having an online component, but also an in-person component, learning in the classroom. We recognize that there may be some parents who are undecided or uncertain about sending their children back to in-person learning. And we want to be mindful of that. So after our last town hall this week, after people have had a chance to hear us explain the plan a little bit, have their questions answered, we will be sending out a form which parents will fill out only if they want to opt out of any in-person learning activities. This form will go out, and if you are a family who has a child or children that you would like to participate fully in remote learning, you will fill that form out for each child. And doing so, you must understand that for scheduling purposes, we must, once you fill that out saying you do not want your child to participate in any in-person learning, you will not have an opportunity to opt back into any in-person learning activities until for the secondary, the next quarter, or at the elementary, the next trimester. Just a few things about the scheduling process. It's a very complicated process. Our schedulers and building principals are working tirelessly to make sure that they can get this out to us as soon as possible, because we know you're looking for childcare. You want to know a little bit about what the fall will look like. We are trying to take into consideration if you are a family who has children in the secondary levels and the elementary levels, we are looking to pair up your children so that you can arrange childcare. They can take the bus. Their in-person learning days will be at the same time. So we're looking to that to be one of the main functions of that scheduling component. I want to touch base next on attendance. Because attendance is not only, we know that having our children participate in our learning schedule and in the learning plan associated with that schedule is a key component to their success, keeping them connected, keeping them engaged with their teachers, their coursework, their peers. Want to just touch a moment on what that attendance will look like. So because it is a cohort day, because it is a cohort schedule, meaning that we have to ensure that there are portions of students at home to allow us to socially distance the in-person time period. Once you are assigned to a cohort, you must follow that cohort schedule. You can't come in on a day that is not your on-site day. So if it's a gold day and you are in the blue cohort, you must attend remotely. In a similar way, if it is your gold day and you are able to attend because you're healthy, you've passed the screening, you should be in attendance on school. So just a little bit about attendance. The procedures for our hybrid opening at the elementary level, teachers will take attendance twice a day for both in-person and remote learners. It will be taken after the pledge, and then the second time will be taken after lunch. If you have a student who is learning remotely, they will be considered present if they are logged into the teacher's Google Meet and they are participating in the learning activities for the day. At the secondary level, teachers will take attendance within the first 5 minutes of the period for both on-site and remote learners. And again, in a similar manner, a remote learner is considered present if they're logged into the Google Meet and actively participating in the teacher's learning plan. Now, there may be an instance because of the cohort that, as we mentioned, if a child shows up to school for in-person learning on a day that they are not assigned to, for safety purposes, we will contact the parent or guardian of record and have them pick up their child immediately. We have to make sure that we have enough space within the CDC guidelines and within our physical limitations of our classrooms to ensure that the students who are supposed to be on site have that ability. If you have a child who is scheduled for in-person learning or remote learning and they are unable to attend because of illness or other reasons, please do call into the building and let them know that. If you have a child who is scheduled to be in person and they are unable to attend because they failed their health screening or they're feeling ill, but they do feel that they have and they are able to participate in remote learning, please again call into the building to let the building know that, and let them know that your son or daughter will be joining the remote portion of the learning day. And again, if they are not scheduled to be in person, please do not send your child into school, because we will call parent or guardian of record to have them come home. The other portion of our plan is, I know that some of you are wondering, what will this classroom look like? How will my son or daughter learn by a stream? Where will the camera be pointed? We are reinventing school as we know it. We have a fantastic group of instructional coaches and other staff developers to work with our teachers and get their best thinking out. And we'll be hosting frequent meets with our teachers to talk about what this teaching and learning environment might look like, look at their questions. I anticipate a mixture of teacher-directed activities, group or partner work. We're looking to really have, because even in the classroom, it's not as simple as saying, okay, partner up with those next to you and read through this text, come up with a couple questions that you have about it, and one most important thing that you learned about it. We still have to remain follow social distance protocols. So we anticipate working with our teachers to look at their instructional grouping. So how we can group those on-site learners with the remote learners to not only allow them to do partner work or group work, but to maybe have smaller breakout groups and keep that connection between the remote learners who are not in the classroom, who might need some clarification on what they heard. They'll be able to do that with those on-site learners. So we have a lot of professional development work that we're going to be engaging in to prepare our teachers to help support them as they participate in this new classroom environment. So that's also on our radar as well. And other than that, I'll transition now to the next portion of our session. It's going to be primarily right now our question and answer period. So again, we're going to disable the chat just because, as we stated at the beginning, it is difficult to make sure we address all the questions in the chat. We will be asking you to raise your hand. Dr. Stoll and I will do our best to make sure that we do call on you. If you're looking to raise your hand, you should click on the participants button. And at the bottom of that, you will have an option to raise your hand, and Dr. Stoll and I will be able to see the hand raised. So when we do call upon you, we'll call upon you on your screen name, because that's how we can refer to you. And we'll go in the order that I see them pop up at the time when we call your screen name. So just take a look at what you have written into Zoom. Please do go ahead and unmute yourself. And you can, at that time also, if you want to, you can start sharing your video. The first hand that we see raised is screen name DIGNA 2271.
Hi, can you hear me? Good afternoon.
Good afternoon.
Hi, I have two children, one in high school and one in elementary school. And I just want to know if they could be in the same cohort per se, so that they are in school at the same time. Is that possible?
Sure, great. That is, so as we look to schedule, that is one of the main, yes, that is our approach. We are looking to pair, to the best of our ability, those students, if we have families who have students in the elementary and secondary, so that can help with childcare and also help with transportation as well. So that is our plan.
Okay, perfect. Thank you.
You're welcome. The next individual that we have raising their hand is screen name Tommy Spin. I will ask you to unmute.
Hi, good afternoon.
Good afternoon.
I know you just answered the question about children in multiple schools. I have twins in the same grade in the same school. Will they be able to go the same day at the same time?
Yes, that is our approach. We are trying to make sure that if families have siblings, I guess that's the best way to look at it. If we have siblings, we're going to try to put siblings into the same cohort.
So we're looking at households. So if there's a family with students that are school age in the same household, we're trying to cohort them together on the blue or the gold day.
Okay, thank you.
And apparently the chat was enabled. I apologize for that after telling you the chat was disabled. So please, if you are posting questions to the chat, we do want to make sure you raise your hand. I did get notice that anything that was posted in there, we will try to the best of our abilities to capture and answer at a later time. But we are asking you to raise your hand, and we'll go through as many questions as we can. And we'll talk about, if you don't get your question answered here, how you can post that. So the next screen name that we have Stephanie Albatelli. I will ask you to unmute yourself and state your question.
Hi, so I had a question about the live streaming, and I was just curious how that was going to work. Was it going to be like a Meet, a Zoom? Is it going to be just the teacher on the camera, or is it going to be the children that are in the classroom also? And also just, I'm also a teacher in a different district, and I feel uncomfortable as a teacher having that all day. Like, we're not used to standing on a mark and trying to be on the camera the whole time. So I'm really feeling anxious about that as a parent as well for my child.
Well, thank you for sharing your question, your concern. We anticipate, as you said, the camera will be placed in a location that focuses on the teacher only. So we will not be doing a panoramic view of the classroom. We will try to encompass the interactive display behind the teacher and do it in such a way that also does not capture students if they have to walk to use the restroom or facilities. We will not point it to towards the class. Students learning in person will not have their cameras on either as well, just as a component of that. So as a teacher, we're imagining, and this is something we're going to work with our staff developers on and our teachers now that we have the safety considerations and the framework of what we can have in the classroom. This is definitely something we're going to engage our teachers on and our staff developers to talk about the mixture of teacher-directed instruction, peer-to-peer instruction, and then how to make that connection between the students who are in person and also learning remotely. So if you're thinking of a combination of I do, you do, we do, whether it be small group facilitation, teachers breaking out with students to check their progress, allowing a student who's at home, putting in a protocol, hey class, I want you to read this text. If you're at home, you're going to partner up with your in-class partner, or I want you to do this independently. Come back in 10 minutes and we'll come together. You can feel free to turn your camera off at home and engage with the materials that I'm asking you to look at, but make sure you keep your audio on. So when you hear me come back as the teacher and the class back together, we're going to come back together. So it's definitely something that we have large frameworks of what we believe can happen, but we definitely want to engage in some staff development conversations about that.
Okay, thank you.
You're welcome. Next individual, I have a screen name of Brian, Natoli, Natoli. Please go ahead and unmute yourself, Brian.
First of all, I just want to say thank you to you and your team. I know this can't be easy on you as well, and I know you are all probably putting in a lot of hours putting all these plans together, so thank you for that. My question is, I don't want to dawn on the negative, but what is the protocol when a child does test positive? What's the reaction? What's the plan? And is there a certain percentage amount of children that test positive that would necessitate switching back to a full home at time learning?
So, Brian, thank you for the question, and thank you for, I'm sure we're all thinking about this. We're all concerned about this consistently. So number one, we wouldn't know unless the Department of Health let us know that someone has tested positive. So there is HIPAA legislation around that or regulation around that. So, if you go to your doctor and you don't tell us, they have to report it to the Department of Health. The Department of Health will tell us and then tell us what the school needs to do in reaction. We do have parents that report it to us, and if they have a positive testing, my understanding is that has to be reported to the Department of Health. In our plan, it does talk a little bit about what the protocol is about returning to school after an illness if a person is diagnosed by a healthcare provider. It's been at least 10 days since the individual last had symptoms. It's been at least 3 days since the individual has had a fever without using fever-reducing medications. And it has been at least 3 days since the individual's symptoms improved, including cough and shortness of breath. So usually, with the case numbers the way they are right now, Department of Health has been really involved with that community, and we will partner with them. But in general, that's the CDC guidelines for returning after a person diagnosed with COVID-19.
So then it's not mandatory for a parent to report if their child is tested positive. You have to wait and hear from the department.
Well, there's a screening tool, right? And so we believe our families are going to be honest with us when one of the screening question is, have you tested positive for COVID-19? If the screening question is yes, and you report that through the app, it's going to tell you to stay home. One of our nurses will contact and make sure that we're working from a healthcare perspective. So again, students that, if for whatever reason, students come into the building and weren't, the parents didn't do it, we will do a health screening and ask those questions. So, again, we can only be as good as the community partnership that we have. We understand that everybody is concerned. We also understand that the health and safety and wellness of your children, our staff, our community is foremost. So yeah, we're all going to have to report. Even staff members are going to have to, take their temperature, report daily before we come in. The other thing is we're not going to have visitors in our buildings either. I forgot to mention that. That's really, really, really important unless it's an emergency. We are cohorting our kids by blue and gold for a purpose. We are limiting the amount of people coming in and out. We're going to do as many meetings as we can virtually. CSE meetings, parent meetings, team meetings. We're going to try to limit the amount of movement and the amount of people coming in and out of our buildings. So all of these things together, I think, as Mr. DiCarlo said, all of us playing our part as an individual, all of us playing our part as a community member will help keep our kids in school. And that's really what we want to maximize.
All right. Thank you very much.
Next, who has their hand raised? Jen Kearns. Go ahead and please unmute yourself and feel free to state your question.
Hi, can you hear me?
Yes, ma'am.
Okay, I just had a question about the cohort scheduling. And first, I appreciate everything you guys are doing. Is the cohort scheduling set in stone where the kids are going to be in 3 days, 1 week, 2 in the next? I know as a working parent, it's inconsistent to say, hey, to my job, okay, I need to be home 2 days, 1 week, 3 days the next week.
So the cohort will cycle through on a 2-week rotation. So if we look at the schedule, week 1, you would have the blue cohort in 3 days, the gold cohort in 2 days. The next week, it would be vice versa. The blue cohort would be in 2 days, the gold cohort in 3 days. So there is that rotation just to make sure that there's equity in amount of seat time and the amount of in-person instruction that they receive. We do recognize it's not the best. It doesn't solve everything with healthcare, or with childcare, but we're trying to bring as much stability to those decisions as possible.
Right. I think with a 5-day work week, right, we have an even number of 2. We know that Mondays and Tuesdays will always be blue. We know that Thursdays and Fridays will always be gold. The only change will be that Wednesday day. If we had a 6-day school week, then we could even it out and we could be consistent, But we're hoping that at least that sense of, and we'll put out a calendar for the entire year that you'll know which Wednesdays are an on day or an off day for your particular child. I wish we could have been more specific about it, but I think that's as close as we could get given it's an odd number of days.
Okay, thank you.
Mike, this is Mr. DiCarlo, everybody. I just want to intercede on Mr. Natoli's comment. This has always been on the books, but it's so important now to parents, and probably most of you, I'm preaching to the choir. You have to keep your child, has to be fever-free for 24 hours. Please do not doctor them up and send them in. That's when we're going to get the uptick. You really have to see if something's going on. So please, it's always been in the books, but it's more important now than ever. Make sure your child is fever-free. The same thing we're telling our staff, for 24 hours without giving themselves some type of medication, so that we can see if it's something more than just a normal run-of-the-flu temperature. That's very, very important. I also want to share with you something that just came breaking on the news, and this is what I said before. The Governor Cuomo today made a statement up in Albany about schools having to do rapid testing. That's why I said to you, things are changing from day to day. So what we're talking about now, I can't tell you what's going to happen between now and the beginning of September, but that's a case in point. As you were on this presentation, I got an email from a colleague of mine that the governor made a comment today about, I'm not sure schools can open unless we talk about doing some form of rapid testing. How that's being done, who's paying for it, this is what happens. So I'm just giving you an example. So stay tuned, because now you can understand our frustration as school districts and, of course, your frustration as parents, because it's so very difficult to plan things when literally, as I'm mentioning to you now, day to day, things are changing.
Thank you, Mr. DiCarlo. I have the next individual who has their hand raised, has a screen name of Fake Pops. Would you mind unmuting yourself and feel free to ask your question?
Hi, I'm the parent of a first grader. When she's home, is she expected to be online 6 hours straight? I know you mentioned attendance would be taken twice, but that seems like an awful lot of screen time to sit there and expect a first grader to sit there.
So it's a good question, because again, this is a school as none of us have seen it before. We anticipate that working with teachers to help really explore the instructional approaches to this, to make sure that we have a good mixture of teacher-led instruction, where students would be, if you're learning remotely, of course, you'd be connecting to see the teacher. Things such as providing direct instruction, explaining directions, responding to students' questions. We anticipate the remote students could connect for those activities. They also would connect to a camera when working with in small breakout groups or pair groups. We also anticipate opportunities to engage in independent practice or work that may allow them to turn off the camera for a little bit of time, engage with any of the content that the teacher has designed through instructional activities, and then rejoin the class by turning on the camera when it's time to gather as a class. So again, it's reimagining what the classroom will look like, and we're going to work with our teachers on how we can make sure that we have opportunities for both teacher-led instruction, peer-to-peer interaction, and then independent work as well too. And your son or daughter may choose to, when there is that independent work, turn off the camera, leave the audio on, so they might be able to listen to instructions coming from the teacher, or if the teacher has identified a misunderstanding that they want to share with the class.
We also know it's going to be age appropriate. We have some fantastic teachers that understand their students, that understand child development. And certainly having a first grader or a kindergartner or even a second grader 6 hours a day staring at a screen is not appropriate. You know, again, what we would love in a perfect world for this whole thing to go away and our kids to be in school, working together, collaboratively, close together. You know, the new normal right now, for now, is that we got to keep kids safe. So certainly getting a first grader in front of a screen for 6 hours is developmentally inappropriate. However, the converse of that, of having a kid not be synchronous and a first grader not being remote or being fully remote and not connected in real time with their classmates or their teacher, is not appropriate either. Our teachers are going to do a lot of work and thinking about their students and providing appropriate mix between being online and interactive in real time and being able to do some sit and think and work independently and collaboratively remotely. So it's a great question.
Thank you.
You're welcome. You're welcome. Next in the to ask a question is Kim Caruso. Please go ahead and unmute yourself, and we're looking forward to your question.
Hi, yes. I just wanted to ask about how for the kids who are in school, how their lunch break will work or any recess. And then also on the buses on the way to school and home, will there be someone on there, especially for the little ones, to make sure they're not removing their masks at inappropriate times?
Kim, great question. We'll go ahead and have Sandra Clohesi, our Assistant Superintendent for Business, take the last part of that question first in terms of transportation, what that might look like.
So currently, we are working on our plan for transportation to have limited students on the bus. They will all have to wear a mask. They will all need to be have it reinforced, not just in school, but at home. As of right now, there will be bus drivers on the bus, but unless it's a mandated assistant, the buses will not have an assistant at this time. So we're asking all of you to please reinforce that mask, wearing that mask outside of the home, in school, on the bus. They will get mask breaks during the day through their classrooms. But when they are on the bus and when they are in the classroom, they do need to keep those masks on.
And to speak to that, thank you, Sandra. To speak to the other 2 points about recess and cafeteria, we as part of our walkthroughs, and we're still engaged in the walkthroughs, we're going through each, as Mr. DiCarlo said before, we're going through each building and looking at the cafeterias, talking with the principals about what they see their space being able to handle, making sure we have their input and getting a view of what that lunch service might look like and what recess might look like. We want our kids to be outside. We want our kids to be in the fresh air when it's safe and the weather is accommodating to that. So we're working with the principals, and each building is looking at possibilities such as meal delivery. They're looking at eating in the classroom when not possible. So we're taking into consideration by location all of those approaches to make sure that we can keep our kids socially distanced and safe, yet try to have school as normal as possible.
Thank you. Thank you.
You're welcome. Next up, who has their hand, is Shirley DePena. Please go ahead and unmute yourself, and we're looking forward to your question.
Yes. Hi, good afternoon. I was just wondering how many students would be in each classroom when they're in person?
Mm-hmm. Great question. So again, varies by location. At the high school, I heard that we're able to get approximately 13 students in a classroom. It all depends upon the size of the classroom that's there. So we're trying to make sure that we have approximately half of the students able to be in the classrooms. We move classrooms around. Greg, do you have anything else that you want to further elaborate on?
I think it's a great question. And the whole reason I think that we, for safety purposes, have to adopt the hybrid model is the square footages on our classrooms. Some classrooms are bigger, some classrooms are not that big. So as Mr. Trombley said, when we have half of our population staying at the high school, we're averaging about 13 students per class. And when we walked around and looked at the square footages of our biggest class, that's about, and you know, high school kids are bigger too. That's about as many kids as we could fit in. And at the elementary school, we're looking around 12 or so for a general education classroom. And again, it really has to do with our physical plant and our footprint, that if we put any more students in there, we don't believe we could socially distance or physically distance them in an appropriate way.
Okay, thank you.
You're welcome. Next up who has their hand for a question is Kimberly Lundy. Please unmute yourself, and we're looking forward to your question.
Hello, thanks all for the planning and scheduling. The question that I have is, what is a mask break going to look like? Because if there's a room to have a mask break, then they'd all be in the same room. So I'm kind of confused at what a mask break looks like. And secondly, is there a modified schedule happening, like for elementary versus middle versus high? Are we starting sooner, later? I guess I'm wondering the scheduling and what a mask break looks like.
Greg, do you want to go ahead and take?
Yeah, so mask breaks, we're going to work with our staff and with our nurses to look at a few things. One is sometimes kids may need some air, where they maybe walk outside in the nice weather. Classes will take mask breaks, go outside, physically distance. There's the other thing is we're going to look at, since we only have 12 kids or so in the elementary in a classroom, we can do things such as have a corner of the room where kids one at a time can take a mask break. We can have a window open where there can be circulation. It's really going to depend on, look, classrooms are not going to look like they used to look. We are kind of taking all of the extraneous stuff that we loved before, comfortable seating, collaborative seating, all that stuff is going out in the classroom. So, Kimberly, I think it's really important for us to understand that, this isn't going to be the way it was. So we're going to have to dedicate a space in there. Like we used to have sensory breaks or, sit and chill spot in an elementary classroom. There may be a mask break section of the classroom, and it's really going to have to work with each individual teacher. And then I think, to get to your point of what will the beginning and the opening of school, and I'll kick it over to Mr. Trombley, is because we know we have to think about these things that we've never had to think about in our entire, my over 22 years working in schools. We need some time to work with our teachers and get some feedback and work with our health professionals. So Mike will talk a little bit about the opening of school is going to look a little bit different than it has in the past. But that's a great question.
Yeah, Kim, so what we're looking at is if you look at our schedule for the opening, you can see that starting September 9th is going to be the first day where we have students on site, and that'll be a blue cohort day. And so whether you're elementary, middle, or high, if you're in the blue cohort, and that'll be assigned in the near future here, you will be in school for a half day. The purpose of those half days is going to be, we're anticipating it being a couple things. We're going to test out our processes. We're going to see, do we need to maybe look at how did arrival impact instruction? We are anticipating using our already established schedules, whether it be fully in person, whether it be hybrid, or whether it be distance, maintaining that normalcy of the schedule. But on those half days, the 9th and the 10th, we're going to look at what does arrival look like, what does dismissal look like, in addition to exploring things such as training our students to participate in this new classroom, because they've never learned in an environment like this. So we're going to talk about things such as proper hygiene. We're going to show them what we expect, how to wash our hands, where to take the mask break. How do we accommodate for maybe now going down to get lunch is going to look a little bit different, or lunch delivery. So those are all things that we're going to, and we know we've had a norm going back all the way to March 6th, that day 1 is not going to look like day 20. Day 20 is not going to look like day 40. And that's why we say we're flexible in our approach here, because we want to make sure we adjust as needed. We listen to the feedback of our teachers of what's working well, of our students of what's working well, of our building principals. So all those things, that's why we're sort of having a half day openings to work out some of those kinks before we go full into it on the 14th.
But once it starts on the 14th, does it go to like the normal operating hours?
Yeah.
Correct. In terms of our instructional schedule, yes. The master schedules will follow as to the best of our knowledge right now. At the middle school, the 7:55 times frame for the first period. And another thing, once the learning day is over, though, we are asking the buildings to close down as quickly as possible so we can get our. So that's including, as of right now, extracurriculars, those types of things. We will be shutting down to make sure we give our custodial staff enough time to engage in those rigorous cleaning protocols.
Thank you all, much appreciated.
You're welcome. We have a screen name of Lisa _ who has a question. Please go ahead and unmute yourself, and we're looking forward to your question.
Hi, I'm asking on behalf of myself and a bunch of other working moms. I go back to work in September. My school will be open in 2. And I guess my main question is, did the district consider putting out a survey to families with both parents that have to go back to work? Like, is there a struggle when it comes to childcare? Because on my end, my 70-year-old parents would be the ones that have to help me out, and I really wouldn't want to now expose them to this virus if my kids are exposed in school.
So, Lisa, we didn't put a survey out specifically asking about would childcare be a burden. I think we knew that it would be as part of any reopening that did not include full face-to-face. We knew that childcare would be a concern. In some town halls we had earlier, I can tell you loud and clear that we captured from parents the fact that we're working parents. We have one parent who's working. We have one parent two parents who are working. Childcare is a concern for us. That came through loud and clear in the town halls that we had. It came through loud and clear in the thought exchange, which is similar to a survey. It's not your traditional answer these 7 questions. We saw it in that information, and we also saw it in the shared Padlet, which was that shared bulletin board that associated some of our earlier town halls. That came through loud and clear, and was part of the reasoning why we wanted to make sure that wherever we could give you a schedule to really help plan around the best we could what childcare could look like.
Okay, thank you.
Next up, asking a question is Megan Capolini. Please unmute yourself, and we're looking forward to your question.
Hi, my question is regarding scheduling for the secondary level for the middle schoolers and high schoolers. How are they going to be managing the classroom changes, or are they even actually changing classrooms to go between, math and English or whatever it might be?
Great question. So one of the reasons behind the cohort was to try to, again, mitigate interactions of students. The struggle at the secondary level is that we have students who change. They're not cohorted within their necessarily all the time their grade. They have a schedule where I may be in chemistry with a bunch of students. I may be in social studies with a bunch of other students. but we're trying at wherever we can to mitigate the movement of students. It works a little bit easier at the elementary level. That's why those cleaning protocols are in there as well too.
So the other thing, Megan, is the middle school is in teams. So they're going to try to keep the teams on like a gold day or a blue day together and have the teachers move. The high school's a little bit differently, as Mr. Tremblay said. Like in U.S. history, you can have 11th graders, you can have a 12th grader. So it's a little harder to cohort when you're really departmentalized by the high school. So that's the whole reason for at least splitting the population in half by blue and by gold, so that you can at least mitigate some of that. The other thing is, right, passing times, the building principals are looking at the secondary about passing times and releasing, different release points. I'm just making this up. They're thinking through these things. Again, we don't have a playbook for this of like, all right, if you're 6th period to 7th period, if your last name, like let's say blue quarters in, if your last name's 8th or whatever, you release, wait 30 seconds, release the rest. So reduce the density in the hallways. There's nothing about this plan that prevents everything. That's why it's a mitigation plan. So the high school is darn near impossible to keep kids still, given the different maturations of their schedule. Middle school, it's a little bit easier, and they're doing that by team. And the elementary school is even easier. So that's just kind of the thinking around the cohorting and how we do it once a cohort is in.
Okay, so thank you. I think I'm wrapping my brain a little bit around it, but so let's say that there's a student who may need a different level of support, like say for math, or like you have a student who might be able to participate with accelerated math, but another student on the team isn't and is in the general math. Like how are you handling the teachers? Are you just going to have like a cohort of kids together all day on that team in the middle school? So all of the kids who are taking accelerated math will be in every class together, for example?
As much as possible, yes. They're looking at that. Mr. Keevans is working on the middle school schedule. It's not the way under normal circumstances we'd like to do it, but given the fact that we're trying to reduce movement, we try to look at, the schedules that are alike. So if they're in a particular math level, those kids will be together kind of all day, because typically their schedules kind of mirror each other in terms of their course selection. So again, not how we normally do it, but remember, this whole plan is built first on the safety and welfare of our staff and our students. And then from there, we make decisions based upon, what's educationally sound. We try to marry the two, but the health and safety is first and foremost. And in order to, at least at the middle school, reduce movement, is kind of how we're going to have to schedule the students.
No, I understand it fully. I'm an educator myself. I'm imagining that at some degree that might be possible in the high school too. I
think they're looking at it. They're really looking at the course requests by each student, trying to figure out, like, again, we're not done. We don't know exactly, at or about August 14th. We hope to give people their cohorts with blue or gold, or if you're coming in all days, if you're a student with a disability and has significant needs, or an at-risk second language learner. But they're working on all those things now, trying to, even at the high school, trying to limit movement as much as possible, knowing that, trying to eat, because even in the high school, our staff share classes. So we're trying to reduce also the amount of classrooms that are shared among staff, because we don't have a one-to-one ratio of the number of teachers we have at the high school and the number of instructional settings in terms of classrooms either.
If you think of scheduling priorities, the first sort of priority was to try to arrange students by households to see if they could be in the same cohort. And then it drills down to what their individual schedules might look like too.
Oh, I absolutely appreciate it at all levels. I'm just, I happen to have a high schooler, middle schooler, and elementary school. So I'm just, just trying to put it all together. And I know it's not easy. So thank you for all of the hard work.
Thank you, Megan.
We have a great team of schedulers who have even started looking at how we use our current systems. They've received training on how they use the current systems for scheduling in a more progressive way to deal with the health crisis.
Thank you.
The next individual who has a question, I'm just going to spell out the screen name. It's DRANAULAJ. Feel free to go ahead and unmute yourself and go ahead and ask your question.
Hi, can you hear me?
Yes, ma'am.
Hi, how are you? Just had a quick question. I understand this hybrid schedule is going into effect. Wonderful. Just are we committing to this for the entire school year, or are we going to readdress it at some point? Because the other guy, I'm sorry if I don't know his name, he said that the schedule is going to be put together, a calendar for the entire year. So I'm just kind of wondering.
Sure. So that's the schedule being put together with blue and gold days for the entire year is just so that you can, as a family, have a plan. If we are allowed, due to the nature of the health crisis, if we are told that it is safe enough to resume in-person learning, that's our ultimate goal. We don't get to make that call. We rely on regulatory and authorities and Department of Health, New York State Education Department. So we have to take our lead of what schedule we implement from them. If you look at our plan, we have 3 approaches: the full in-person schedule, which would be a normal, quote unquote, normal school year schedule where we have kids and teachers in. We have the hybrid approach where, for safety purposes, we're limiting the number of students in the school so we can socially distance and follow CDC guidelines. And then we also have the other option where, if we're told to by the Department of Health, we have to shut down all, we cannot bring any kids in. We will have to implement that aspect as well. At this point in time, we do not get to make that call. We have to have plan for all 3 of those approaches, though.
Sure. Okay, wonderful. Thank you. And just one side question. Sports is kind of like on a hold now, correct?
So it's Mr. DeCarlo. I happen to sit on the Section 1 Executive Committee. So right now it's on hold till September 21st. Again, it's up to the governor. But as soon as we hear something, we'll let you know. If for some reason it is postponed until January, then we'll give you what that update may look like, because what they're looking to do is possibly get all of the 3 seasons in from January to June, but that's yet to be determined.
Gotcha. Thank you. All right.
You're welcome.
Next in the question list is username Cami. Please go ahead and unmute yourself, and we look forward to your question.
Hi, can you hear me?
Yes.
Yes, ma'am.
Okay. First of all, I would just like to start off by saying thank you for everything that you guys are doing. I know this has been a challenge for everybody, and I really appreciate all the time and effort that everybody's put into this. The real question I have for you is, I have 2 children in the elementary school. One is asthmatic and has other things going on, and my other child has severe allergies. And I know that both girls could not wear the mask all day, and for more than about 10 minutes, just at home and in general, when we're outside, they have difficulty with the mask. If we opt to do if we take them out of the in-person education, will they still be able to participate in like the Google Meets and with their classroom?
Yeah, of course. If for any reason any parent feels uncomfortable or uncertain about sending their children back in, you'll go into you won't have the on-site component of the hybrid plan. You'll still follow the regular schedule. You'll join every teacher's meet. You'll have the opportunity to interact. You just won't have that on-site component of the hybrid learning. It won't be a separate container or schedule for those students who want to just learn purely remotely.
And with that being said, with the younger one who has asthma, she has a push in reading that comes into her. She was not tested yet with an IEP, but will there be resumed testing for an IEP? And if she does need special services?
So I want to make sure we answer your question. It's secondary. I would, because as we're starting to get in some confidentiality, this is an open meeting, I would ask that you either contact me directly or contact Dr. Sweeney at the secondary level, our special administrator for second ed. We can't get in, as we start to get into student-specific questions, those are way better addressed at the building level, or you can feel free to call me. This is just an open meeting. I want to make sure we
I'm sorry about that.
Your child's privacy.
No, but to your question, just as in general, I'm not specifically, this is Mr. DeCarlo. I know Dr. Stoll will say, what we normally do, we still do, right? Just because we may not be, in person all the time, we are still doing all the testing and things that a parent may need to have done. We'll definitely be able to do that. So I think that's an important piece.
Thank you, Mr. DeCarlo, for that. And any student that receives like reading services or intervention services that opts to do remotely, those students will be provided those services remotely. So The difference is going to be the location. Instead of getting it in school, you're going to get it remotely.
Okay, thank you very much. I appreciate it.
Thank you for the question.
Next, Joanne T., would you please unmute yourself and feel free to state your question?
Hi, can you hear me?
Yes.
Hi, thanks for taking the time to answer my question. I have a question regarding the blue and gold cohorts, which is slightly different than the questions you've been asked before. If, as a parent, I feel more comfortable having my 2 teenage boys go on opposite days, is that a possibility?
Depends on the schedule.
Yeah, I think one of the things I think is really important, I'd have those questions directly with either Mr. DiCarlo, myself, or Mr. Trombley. Remember, one of the things that we're trying to do is, this is a mitigation technique, is we're trying to separate people that will be in a building by household. And so that kind of undoes the safety and health. If there is an extenuating circumstance or something we need to talk about, we can have those individual discussions. But by and large, the issue is we're trying to delineate that when gold is in, blue is home, and when blue is in, gold is home to the greatest extent practicable, just because that is the health, that is the science and the health guidance around keeping us healthy, keeping us safe, and keeping us in school. But
yeah, and that does lessen possible exposure, which makes sense. Okay.
But thank you, Joanne. That's a great question. And we're here if you want to discuss individual concerns that you have for your family. We have our contact information on the site.
Right. I'll revisit that in my own mind. But thanks again. Bye.
Kim Shurak, you have your hand raised next.
How are you? Thank you so much for taking the time and providing us this opportunity for questions. Really, my question has to deal with if my child is opted out. She's at the high school level. Will her teachers change from the 14th? So if her teachers are set on the 14th, let's say I opt her out, will she still have those teachers?
So we're anticipating to have the best known cohort designations by that on or about the 14th. Students' specific schedules as far as classes, which classes they will be attending, that we still anticipate being released more closer towards the opening because there are so many internal changes in terms of class specific schedules. So you won't see your class schedule with teacher and course section that they're going to be in till later on in the summer, as it would normally appear in the portal.
But we're not. But I think to your question, hi, this is Mr. DiCarlo. No, whatever the assigned teachers are, that's the assigned teachers. Just because you opt out does not mean we would change the teachers on your daughter. No, not at all.
Great. And also, my daughter's question really has to do with participation in clubs.
Yeah.
How's that?
Yeah, that's a great. Yeah, that what we're anticipating on doing is that we probably most likely will start the year out with the clubs remotely, so that the clubs will still take place. They will probably be done remotely. Again, depending on what happens during the course of the year, we'd love to get them back together again, but they will take place, but they will be done in the beginning of the year remotely.
Great. Thank you so much.
You're welcome. Thank you. And best of luck to your daughter.
Thank you.
Just to clarify, this was going to be addressed in next steps, but Kim, because you brought it up, the timeline of what we anticipate. So we're having, our plans were uploaded and submitted on Friday. We're now starting to have communicate information about those plans so families can make informed decisions about do they want to send their kids as part of this hybrid, or do they feel more comfortable opting out? After our next town hall meeting, that opt-out form will be sent out to parents, and any parents who want to take advantage of that opt-out will have to do so within a limited time period to let us know for scheduling purposes, so we can build those cohorts, so we know what numbers we're looking at bringing in to be part of, to make sure we have the correct balance and numbers of kids within the schedule. So there will be a tight turnaround time for parents to let us know that information, and that tight turnaround time is needed to allow us to get out this information about the cohort designations as quickly as possible to help parents make and notify their childcare providers.
The other thing in reference to that, I remember during an earlier conversation that you are allowed to opt back in.
Yes.
So you will be sending out another one, let's say, after the first quarter, she's home, what have you, then another email will come saying we want in or we still want out.
Correct. That's correct.
we are still in a position where we have to engage in some measure of mitigation through the hybrid schedule. At the elementary, we do it on the trimester basis. At the secondary levels, we do it on the quarterly basis.
Yeah.
Great. Thank you so much.
You're welcome. Next in the question queue is Seth Mazzella. Please go ahead and unmute yourself and feel free to state your question.
Thank you. My question is based on some of the guidance that I've read with regard to students with special needs and having 5-day-a-week in-person instruction. I guess could you kind of explain which students will be eligible for that, or if a child has an IEP, will there be an avenue for parents to advocate that they have 5-day-a-week in-person instruction?
Yeah, so Seth, thank you for the question. And certainly students with disabilities have individual conversations about their IEPs. Again, in this health crisis, there is some flexibility by New York State Education Department to ensure that the health and safety of those students are first and foremost, and that we continue to provide a free and appropriate public education. However, there are some students with disabilities that are inequitably impacted by school closure, meaning that they require close proximity. They actually require it as part of their instruction, meaning that these are kids with ambulatory issues, significant issues with cognitive issues, issues with severe language disorders, students on the spectrum that require intensive full-day special education programs and supports. The special ed administrators will certainly be, that's Mr. Fenton at the elementary school, Dr. Sweeney at the secondary, and for out of district right now, it's our interim, Mrs. Carol Rapport-Sommer. We'll be working with families directly. There is a cadre of our most, our students who are in district, or students who are in our most intensive programs that require close proximity. We'll be having conversations with those individuals. As always, Seth, there is an avenue. That's the avenue. You go to the special ed administrator. If it requires a CSE meeting and discussion, then there's that. But right now, the plan is not to have every special education student go in every day. There are some students that can, with the appropriate supports that are being done to the greatest extent practicable through remote services when they're hybrid, that can still receive special education supports appropriately. But we're really focusing on those students typically that are in full day special education classes that require intensive services. But yes, the avenue is always there, discussion's always there. IEPs are made, decisions are made on an individual basis. So, if your child's in the elementary school, please reach out to Mr. Fenton. If your child's in the secondary, please reach out to Dr. Sweeney. Or if they're in out of district, Mrs. Rapport-Sommer at this point will be able to kind of work with you and your family and your student.
Thank you very much.
So we're going to take one final question, as we want to be mindful of everyone's time, because we do have some additional information for you before we get to our 3:30 timeline. Before we leave, we'll also share ways if we didn't get to you. I know there's about 5 more people who have their hand up. If we didn't get to you, we'll share ways that you can have your questions answered. So we'll take the final question from screen name of Sherry Stewart in the question queue.
Hi, can you hear me?
Yes, Sherry.
Hi, first, thank you and your team for everything that you've done. I know a lot of work went into all of this. When you were talking about people receiving an opt-out opportunity, myself and a lot of other people apparently in the community did not receive Friday's email. So I hope that you're aware of that. The only reason I knew about this is because I spoke to someone in the district office today. So I think there's a problem there.
Yeah, so Sherry, we found out what the problem is. Just so you know, and I'm going to send something out later today. And thank you for bringing it here, but since you brought it up, which I think is great, I'll share it publicly. Last Friday's email went out with an attachment. We typically don't send things out with an attachment. What we believe to have happened is that your email provider has saw that as a spam and has either blocked it or put it in your spam. And so what was different from previous is that this last one had an attachment to it. And so we didn't preemptively recognize that may happen. We realized that may have happened. Once we did over the weekend, we kind of submitted it through social media. We will make sure that, number one, we will make sure that we don't send things with attachments so that email service providers don't look at it and see it as spam, because we send out thousands of them. And number two is, this is just kind of one of, now we're living in this digital age. Make sure you check your spam folder. If you see something coming from us, please mark it as safe. And that will that will preclude it from happening again. Also, please make sure that in Infinite Campus through Parent Portal, you update your contact information. We send the email to only the email that that you provide us as an emergency contact, like on snow closure. So sometimes I've worked with families who use one email for emergency contact, and then they looked at the different email system and didn't see it. So all of those things happen, but what we thought was the biggest issue this time was we did send it with an attachment, and I think the email service providers saw it and categorized it as spam. And
yeah, because it didn't go in my spam, just so you know, because I checked there too.
They could have blocked all of it and just not let it.
I think so.
Yeah.
Okay,
so
but also the other thing is when you answered the question earlier about people being allowed back into school after a time out for being tested positive, you said nothing about having to have a negative COVID test result in order for them to return.
That's not the guidance from the CDC. Certainly, the nurse will work with those families, but the guidance from we're just following guidance from CDCs unless it has changed. But it really is that. And does not get a COVID-19, they need to, if a person has been diagnosed with COVID-19 by a healthcare provider or a test, they need to do those things that I said. And so, again, there's no regulation right now that New York State put out that says we have to have a negative test to allow them back in. That's just the guidance. If it changes, we'll update the plan. As we said, Mr. Carlo mentioned, things are changing daily. We will try our best to be flexible.
All right, thank you.
So thank you everyone who submitted the comments, both through our raising the hand function and also through the chat. Well, we tried to make sure we had that disabled to make sure we were equitable in how we approach questions. We did capture those questions, so we'll make sure that we combine those into our FAQs. We do have another town hall. We'll talk about how if you did not get your question asked today, you can have it answered. So we'll get to that in 1 second, but I just want to share my screen with you really quick to talk about our next steps. And these next steps, you should see a blue screen with yellow lettering. These next steps are not all inclusive. There is, as you can imagine, so much work being done behind the scenes by our dedicated staff members, whether it be our principals, making sure that they're looking at those schedules to make sure that the best possible placement is there for your students, or getting the classrooms ready to welcome your students. Our custodial staff, who's doing a fantastic job cleaning, the technology staff, who's making sure we have everything up and ready to go. I know, having talked to some, our teachers are constantly thinking about what the fall is going to look like. So there's so much that this list cannot encompass, but this is probably, if you're here for some of the questions that we had, this is probably what you need to know our next steps are going to be. We want to make sure we're continuing looking at the safety of staff and our students. We will be sending, as soon as this next town hall is completed, the opt-out for in-person learning form. That will help us put on some of those, allow us to start to look at our total numbers that we need to make sure we schedule for in-person. And so we can assign the cohort designations of either blue or gold. Then we're continuing with that to build our actual course schedule, particularly at the secondary level, of what an individual student schedule will look like. That will come out in late August or closer to our actual opening. And we're going to continue to listen to all, communicate, adjust, and adapt as needed, as Dr. Stoll said. So if you still have questions, let's talk about some different avenues on how to go about that. Of course, Dr. Stoll, as the COVID-19 safety officer who ensures compliance with our plan, and myself, the COVID-19 resource officer, who is the main contact for any questions you have about the nature of this health emergency and our plan as a district, feel free to email us there on our at our emails. But also, we want to point you to a website that has been built and dedicated to just to be that spot of information. If you go to the district reopening website mentioned in Mr. DiCarlo's communication of July 31st, or if you are, or if you're able to jot down this website, or I'll also show you how you can access this from our main district website. There is a spot on that web page where you can submit a question as well. So if you were to navigate to our main homepage, our district homepage of mahopack12.ny.us, under the quick links, there is the MCSD reopening site. At that site, you can find all of our archived communications, all of our current communications. You can follow us on social media to remain connected there. You'll see a copy of our plan. That's where you can submit a parent or student technology help desk. If you need resources and assistance, there's a link there. We also are posting our teaching and learning resources for staff, information about health and community safety resources, and then you can submit a question as well too. So those are all there. That is a truly a one-stop spot for all of your questions as well. So make sure you're familiar with that information. And before we leave, we just want to say thank you with this. As we mentioned a couple times, this is an educational community. We miss your students. We miss being able to see them. We know this has been hard on you, on your families, and on your students. And we thank you for your continued partnership, whether it was sending an email asking a question, whether it was saying thank you, whether it was providing a suggestion. We are a community here, and we appreciate you being a part of that. And I will give the last word to Mr. DiCarlo before we sign off and say thank you.
Yes, thank you all for attending. As was mentioned before, believe me, and my leadership team could speak to it, we all want the kids to come back together. And that's why we had to wait for the guidance. That's ultimately our goal. And a lot of the questions that you had asked, which were spot on, are a lot of what we struggled with when we try to put this together. So we're trying our hardest to do what we can do based on the guidance. As I just finished saying to you, I'm sure you'll hear it tonight. You know, the governor has changed some of his thinking today, and who knows what that's going to look like. But, you know, we thank you for your patience. I know being a part of this great community, we'll get through it together. We'll do what we can, do what's best for kids. And we'll be updating you between now and the beginning of the school year. So please make sure you give your best to your families. And we want you to continue to remain safe. And we wish you all the best. Thanks again. Have a great night and enjoy the rest of your summer. Thank you.
Thank you.
Mike.
At this time, we'll go ahead and end the meeting. But I want to say thank you for joining us.
Thank you, everybody.